Hundreds of qualified nurses in Gauteng are demanding employment. They're staging a sit-in at the Health MEC's office. I'm joined now by Nathaniel Mabelebele, National Chairperson of Denosa's student movement. Nathaniel, thank you very much for your time this afternoon. Why are the nurses aggrieved and what are your demands?
The actual fact here is the absorption of community service nurses. The community service nurses who had actually started their community service the previous year with the hope that they would continue with employment because when they signed their contracts in their first year of study, they actually were assured that they will have to work within the same Gauteng province for the number of years they were actually funded for, which is 4 years. That is counting in the 1 year compulsory community service. So now, after a year of that 12-month service of community service, they are told that their contracts are now being terminated. They have no employment, so they must just try to join agencies and look for a job elsewhere.
Nathaniel, we also understand that they've only been given 1 month's notice, and part of the list of demands is that they would either like their employment to be extended for 3 months or that they would like 3 months notice pay. Am I correct?
Actually, there is never a month's notice or any amount of notice. You can even say it's an hour's notice because some of them woke up in the morning and received a call from the managers to say, do not even show up today. There was never a letter that was received to communicate this. It was just a call that was given to them on the very same day that the contract is set to be ending. So it was unprofessional of them to actually do so. And to our surprise, when we started the sit-in at the Charlotte Maxeke, we actually found that Charlotte Maxeke was hiring people. The injustice that they did when we actually arrived there was to actually even tell community service nurses to join those people in the room and witness them signing the contracts that they should have actually gotten in the first place, because they are the ones who were actually in the front line and who were working in that hospital, and they should have been first preference when those are there. So they had to witness people taking jobs that were supposed to be belonging to them. That in itself is brutality. And the CEO actually refused to say, will not actually give out any communication to say that you are terminated or anything of that sort. They just had to get away and say, go home. Hence we took the decision to say, maybe if the CEO of that institution cannot listen to us, and the MEC can understand us. And we took it in further to the 45 commissioner at the Gauteng Department of Health offices, where we were actually met or addressed by the chief nursing officer under the directions of the project coordinator in HR, Dr. Senabe. And the communication that we actually received was that 983 community service nurses, that is the total number of community service nurses that are in Gauteng currently, will be absorbed. Now, the issue there would be that they might not actually be getting employment in the institute they are currently in. So we still have to make a space, because there was budget made available to actually get those posts up. That is one of the factors that were released. However, we demanded as well a form of proof, say that it's not just the word of mouth as well. So we are expecting a circular to communicate this to all the HRs in the institutions throughout the province, so that they know that there is such a communication from the Department of Health to say that all the 983 community service nurses will be absorbed. And the process is said, we agreed that it will take 5 days to actually materialize and for us to see this matter.
Nathaniel, it seems you have received some kind of communication with regards to the way forward. What is the planning around the rest of the sit-in? Are nurses still continuing with that sitting?
So we actually decided that since we got that communication to say you are going to be absorbed, because that's all we wanted. We wanted to be assured that we are going to be employed. So what we actually did after receiving that, we gave the chief nursing officer the benefit of the doubt to say, okay, we will just give you the 5 days to do the work. If then the 5 days, this does not materialize in the next 5 days, then we will have to review our plans. It means this is not a trustworthy person. Then we will have to find other ways of engagement. It might not be a sit-in the next time. The decision will come as time goes, and if we are being played on the matter, then we will actually respond the way that we are based on the mandate that we will discuss amongst each other.
Well, thank you very much for speaking to us, Nathaniel Mabelebele, National Chairperson of Denosa's student movement. Absolutely essential that at a time when our health system is under severe pressure from the COVID-19 pandemic, that these nurses be allowed to assist and do the work that they have been trained to do, especially seeing as we at the moment are experiencing a human resource problem in healthcare institutions across the country.